Welcome to The Explainer. Today, we're diving into something that is literally rewiring modern medicine. We're talking about unlocking healthcare interoperability, specifically how we can take abstract data standards and translate them into real-world, hard-hitting business value. If you've ever wondered how completely different medical software systems actually talk to each other to save lives and cut costs, you are definitely in the right place.
Now think about this for a second. What if every hospital system operated like its own sovereign nation? You've got these nations trying to exchange critical diplomatic notes, but they're all speaking completely different native languages. Total chaos, right? Well, that's pretty much exactly what the pre-HL7 medical landscape looked like. Systems were stubbornly incompatible, and sharing critical patient data was a massive, massive struggle.
And look, we're not just talking about a few minor IT headaches here. The stakes are huge. Get this, a staggering 70% of healthcare organizations say interface issues actively delay their new system go-lives. When these systems can't communicate, modern medicine just grinds to a halt. Budgets explode, and patient care is put at serious risk.
Okay, let's dive into this. First, we'll look at the healthcare communication crisis. Then, we'll unlock the business benefits of HL7, see it in action with some use cases, navigate the hidden pitfalls you absolutely need to avoid, and wrap up with the evolution to FHIR.
Part 1. The Healthcare Communication Crisis. Let's start by looking at exactly how the industry is solving this massive communication barrier between disparate health IT systems.
So, what exactly is HL7? It stands for Health Level 7, and it's an ANSI-recognized standard. Basically, it gives us the framework and formatting rules we need to share electronic health data across totally different medical systems. The main goal here is to make sure your EHRs, lab systems, and billing software are all perfectly in sync. Why? To optimize workflows, wipe out data ambiguity, and ultimately, boost patient safety.
Now, what's really interesting here is the flow. You've got your hospital information system, your radiology and imaging systems, and the clinical endpoints where the staff actually works. Notice the medical integration engine sitting right there in the middle. Think of it as a universal translator. It catches an HL7 message from one system, translates it on the fly, and routes it exactly where the clinician needs it.
Part 2. Unlocking HL7 business benefits. Let's shift gears from the tech side and talk about the hard ROI, because if you're a healthcare leader, understanding this financial imperative is absolutely crucial.
So, what are the core business benefits? First off, HL7 guarantees complete data consistency across your entire network. And here's a huge one. It extends the ROI and lifespan of your legacy systems. This means hospitals don't have to rip out massive, expensive legacy IT infrastructures just to modernize. They can just integrate them instead. It also speeds up rapid medical decision-making by putting the right data in front of the doctor instantly. Plus, it standardizes sharing with outside labs, minimizes medical errors, and drastically cuts administrative costs. It's literally a win-win for the balance sheet and for patient care.
Part 3. HL7 in action. Use cases. Let's actually picture these benefits playing out on a busy hospital floor.
This brilliantly illustrates how HL7 touches literally every single step of a clinical workflow. It kicks in the second a patient books an appointment, triggering the scheduling and reminders. Then it powers process automation. Let's say a doctor orders a lab test. HL7 instantly routes that order to the lab and shoots the results straight back into the EHR. It securely manages all that data exchange. And it even helps with shift management, tracking staff availability so the right people are assigned to the right shift based on real-time needs. Part 4. Navigating hidden integration pitfalls. Okay, reality check time, because it's not all perfectly smooth sailing. The sheer complexity of integration means that 1 in 3 health IT projects actually blow right past their budgets. I want to share a wild, true story from our sources about an ADT, that's admission, discharge, and transfer, message disaster. A regional health system linked up a new EHR with their lab system. Well, because of a super subtle field order mismatch, the interface took a patient's emergency contact phone number and mapped it straight into their date of birth field. And because nobody validated the content beyond checking if the message simply sent, this error went completely undetected for 2 whole weeks. Lab results were hitting the wrong records, triggering a massive patient safety review, and it ended up costing the health system over $200,000 to clean up.
The crucial point to remember here is that interoperability is maybe 20% technology and a whopping 80% governance. The hurdles you're seeing, legacy compatibility, crazy variations in data mapping, patient identity errors, they almost all come back to a lack of strict oversight. Because HL7 allows for flexible segment rules, two different vendors can build the exact same message type in completely different ways. Without strict governance and a master patient index, data variance easily leads to those catastrophic mapping errors we just talked about.
When you compare how to actually do this, you've got a few distinct paths. Native EHR modules are low complexity, sure, but they lock you into a single vendor. Then you've got HL7 FHIR APIs, offering medium complexity, but a ton of standardization. Or you can use integration engines. These are highly complex, but offer maximum flexibility to connect totally different systems. But heads up, whichever route you take, hidden costs like compliance testing or those parallel run periods where you're running the old and new systems together, they can unexpectedly add 10 to 18% to your budget. You absolutely have to plan for that.
Part 5. The evolution. Advancing to FHIR. Now we're transitioning into the bright future of healthcare communication, pushed forward by modern tech and strict regulations like the 21st Century Cures Act.
Enter FHIR, spelled FHIR, which stands for Fast Healthcare Interoperability Resources. This is the open community successor to traditional HL7. It's backed by heavy hitters like Apple, Google, and Microsoft. And the best part is that it was built on the exact same seamless web standards that power the rest of the internet today.
Let's see how this builds on the past. On the left, legacy HL7 version 2 was mostly batch-based. It had super rigid formats, required custom parsers, and was basically just integration at the perimeter. But on the right, modern FHIR is a totally API-driven game changer. It uses real-time, RESTful resources, meaning it acts just like a modern app pulling data instantly over the web. So instead of waiting around for some massive batch file to process, a doctor's app can instantly pull specific data points, like just asking for a patient's medication list completely on demand.
So what does this all mean for you? As AI and these modern FHIR APIs fundamentally reshape the medical landscape, you've really got to ask yourself, is your organization engineered for true, scalable interoperability? Or are you just surviving on expensive temporary fixes? The future of healthcare is entirely data-driven, and getting this integration right is the only way you're going to thrive. Thanks so much for joining me for this explainer, and keep exploring.